HIV transmission and prevention is important as this is a dangerous infection with no cures for now. HIV, or human immunodeficiency virus, is a virus that attacks the body's immune system, leading to acquired immunodeficiency syndrome if not treated effectively. The first time HIV/AIDS was recognized was in the year 1981 by the United States CDC, and the HIV virus was first isolated in 1983. Since then, HIV still remains a significant global public health issue. As of the end of 2022, there were an estimated 39.0 million people living with HIV globally, 630,000 people died from HIV-related causes, and 1.3 million people acquired HIV. Yet no cures have been successfully developed to fight off this virus over the years. However, science has helped us understand HIV more comprehensively, and HIV has gradually become a preventable and manageable chronic health condition. In today's video, we will talk about how can HIV be transmitted and how can we prevent HIV infection. So first and foremost, what are the ways for HIV to get into your body? There are three main ways that one can be infected with HIV. 1. Sexual activities. 2. Contact with blood or body fluid. 3. Mother-to-child transmission. Firstly, HIV can be infected via sexual transmission. HIV is most commonly transmitted through sexual contact, specifically during vaginal or anal sex without using a condom or without taking medicines to prevent or treat HIV. Anal sex is more risky than vaginal sex for HIV transmission. And for all cases, receptive sex is more risky than insertive sex. The risk associated with oral sex is considered to be very low, much lower compared to anal or vaginal sex, and there is no sufficient data to calculate the number. However, it is not zero. Factors that may increase the risk of transmitting HIV through oral sex are oral ulcers, bleeding gums, or genital sores. Secondly, HIV can be infected by contacting with blood or body fluid. Sharing needles, syringes, or other drug injection equipment with someone who has HIV can lead to transmission because these items may have HIV-contaminated blood in them. Being exposed to HIV through a needle stick or sharps injury is also a risk mainly for healthcare workers, though the risk is very low if procedures are strictly followed. Receiving blood transfusions, blood products, or organ tissue transplants that are contaminated with HIV can lead to transmission. However, the risk of this is extremely small nowadays because of rigorous testing of the blood supply and donated organs and tissues. HIV transmission can also occur through contact between broken skin, wounds, or mucous membranes and blood or body fluids from a person who has HIV. But keep in mind that there is no risk of transmission through unbroken skin. Thirdly, mother-to-child transmission. HIV-positive mother can transmit HIV to her baby during pregnancy, birth, or breastfeeding. However, the use of HIV medicines and other strategies have helped lower the risk significantly. When an HIV-positive woman follows her HIV medication throughout her pregnancy and delivery and ensures her newborn is given HIV medication for a period of 4 to 6 weeks after birth, the risk of transmitting HIV can be less than 1%. So, is it certain to be infected with HIV when doing the activities mentioned above? Fortunately, no, it is not certain. It is not a 100% HIV transmission when you do the activities mentioned above. Those above are just the possible ways that HIV can be transmitted. It does not ensure HIV transmission. For a successful HIV transmission, there are 3 conditions need to be met. 1. There must be HIV to begin with. HIV must present either in the partner, the mother, or on products like needles, syringes, etc. If there is no HIV, you won't be infected no matter what you do. 2. Having contact with HIV through the 3 main ways discussed above. And 3. The HIV viral load needs to be high enough for transmission. Usually, in patient with HIV and left untreated, HIV viral load will be very high for transmission. However, with antiretroviral therapy, or ART, the viral load can be suppressed down significantly. If ART was taken as prescribed, usually in 6 months, HIV patient can achieve undetectable level of viral load, which means the HIV viral load is so low that standard lab tests cannot detect it. Patient with undetectable level of viral load will be unlikely to transmit HIV to their HIV-negative partner. Now, even when all of the 3 conditions are met, there is still a probability to get infected with HIV. According to CDC data, the most risky behavior is receptive anal intercourse, and this has a probability of acquiring HIV of 138 per 10,000 exposures or 1 per 72 sex acts. The risk is about 1.4%. We can see that there may be a relatively small chance of acquiring HIV when engaging in a risk behavior with an infected partner only once. However, please keep in mind that if repeated many times, the cumulative probability of infection significantly increases over time. This information is not to discourage you from using protective measures, but as a reassurance that you should not get too worried when you know that you are exposed to HIV. When you do, it is not the end. Stay calm and seek healthcare providers as soon as possible for precise instructions. Best within 72 hours after exposure. That being said, we also need to note some scenarios that HIV is not transmitted. You cannot get HIV from 1. Having casual contact with a person who has HIV, such as a hug or a closed-mouth kiss, often called social kissing. 2. Having contact with objects such as toilet seats, doorknobs, or dishes used by a person who has HIV. 3. Mosquitoes, ticks, or other biting insects don't transmit HIV. And 4. Other sexual activities that do not involve the exchange of body fluids, for example, only touching. Knowing these will help you ease your mind, especially when you are living with a person or a family member who has HIV. HIV is not spread through everyday contact. People with HIV are not dangerous to the people they live with at home or in the community and with whom they have ordinary, non-sexual contact. You only need to avoid sharing personal items such as razors, toothbrushes, or earrings, and be cautious when you have to come into contact with bodily fluid by using gloves and soap in these cases. Now, it's good to know the ways of transmission and all, but can you prevent yourself from getting HIV in the first place? Well, yes, you can prevent yourself from getting infected with HIV, and there are several strategies to help you. There are non-medication strategies for HIV prevention. These include 1. Safe sex practices. Using condoms correctly every time you have sex significantly reduces the risk of HIV transmission. This includes for vaginal, anal, and oral sex. 2. Needle safety. Using new, sterile needles and equipment every single time can prevent HIV transmission. Sharing needles is a high-risk behavior as it can directly introduce HIV into the bloodstream. 3. Education. Being informed about HIV, its transmission routes, and prevention strategies can help individuals make safer choices. 4. Partner communication. Open communication with partners about HIV status and risk can lead to safer sexual practices. 5. Regular testing. Regular HIV testing is crucial for those at risk. Early detection of HIV can lead to early treatment, which can consequently reduce the risk of transmission. In addition, prevention with medications including pre-exposure prophylaxis or PrEP and post-exposure prophylaxis or PEP strategy. PrEP involves taking a specific HIV medication daily or an injectable HIV medicine every 2 months for individuals who are at high risk but do not currently have HIV. This method significantly reduces the risk of getting the virus through sexual intercourse or injection drug use. On the other hand, PEP is a method used after a potential exposure to HIV. It involves taking antiretroviral medicines as soon as possible, but no more than 72 hours after a potential exposure to HIV to prevent becoming infected. Both PrEP and PEP are highly effective when used correctly and consistently, but they are not 100% effective. Therefore, they should be used in combination with other prevention methods such as safe sex practices and safe injection practices. When it comes to medication, please always consult with a healthcare provider for individualized advices and precise instructions. So, to conclude, the transmission of HIV is a significant global health issue. HIV primarily spread through unprotected sexual intercourse, sharing contaminated needles, or from mother to child during childbirth or breastfeeding. However, it is preventable. By promoting safe sex practices, regular testing, use of sterile needles, and using antiretroviral therapy on time, we can significantly reduce the rate of HIV transmission. Furthermore, education and awareness about HIV transmission and prevention are crucial in combating the stigma and misinformation surrounding the disease. Together, these measures can pave the way towards a world free from HIV/AIDS. And this is the end of the video. Hope this helped you know more about HIV transmission and prevention. Don't forget to subscribe and leave a comment. And if you want to know more about the basic of HIV, you are welcome to watch the HIV/AIDS 101 video in my channel for more info. Goodbye and have a great day.